All right. So let me just borrow your hand here for a second. So if you're, like I said, you need to know the anatomy of the area to be able to palpate it. And again, if we're going to check each of these individual carpal bones, you can sort of stabilize like this, stabilize all the other bones, and then you can palpate up and down on each one and can see if there's any laxity, if something's loose or tender, something like that. Basically, you know, if you know all the anatomy, you just palpate the structures that you're aware of. So there's going to be, whenever you palpate, you go through a certain process. You have the bones, the muscles, any certain nerves that in the area, any significant things that you need to palpate. So what we're talking about in this area is, you know, you'll have the styloids of the radius and the ulna, the anatomical snuff box again here, and then the different parts of the bone. You want to palpate the pisiform, right? So that's going to be right here. That's the bone that's sticking out right there. And then if you go a little bit distal, a little bit, I guess that would be lateral, the hook of the hamate. So you can feel that other bony thing, prominence in there. Okay, we can go over this more when we go around. So you have the hook of the pisiform, hook of the hamate, and then the lunate's going to be in here. Then, you know, you're checking the radial and ulnar arteries. You can check the nail beds, and then just palpate the tendons. You know, like I say, maybe you might look for a tendon cyst or something like that. Palpate the different ligaments. Just looking for tenderness. Just palpating the general area. All right, so percussion tests, the same as what we've done in other areas. You're just tapping on the different bones or things that you might suspect where there's an injury. So you can percuss directly over it, or you can do it distally away from the area. So let's say if you might stabilize this with one hand and then press on here. So if I'm doing this and I feel something, the patient feels something in here, there might be an injury to those other areas. Could be a fracture, could be a sprain, strain, things like that. It's going to be predominantly for inert tissue for traumatic injuries, but you know, if somebody has some type of chronic inflammatory thing or overuse syndrome, they may have some tenderness with percussion as well. All right. So then you have axial load. So you're going to stabilize the wrist with one hand, and then you're going to be pressing on the thumb here. You're going to be holding more, you can hold at the phalanx, you can hold up like this, so there could be some type of an injury, fracture to this, to the metacarpal or in the carpals, or you know, injury to the joint surface. Okay, stabilizing up here. Okay. And then Murphy's sign and boxer sign, basically you're looking at the fist like that. And then what are you looking for the Murphy sign? Yeah, you're looking for this knuckle to be in a straight line with the other two. And then for the boxer's fracture, this one's going to be dropped down. And then ligamentous instability test. Those are just, like I say, there's all the different collateral ligaments. So you can check like this. It's kind of like you're doing varus and valgus for all the different ligaments in the hands and finger. Okay. And then, you know, there's a fair amount of radial and ulnar deviation at the wrist. But, you know, if you suspect there could be an injury to either of these ligaments on the side here, you know, you could stress it this way like that. Okay. Okay, so then there's the ligamentous instability, so you're checking valgus and varus at different points. Now you could check it at, obviously there's going to be more motion at this joint, but you can check here, and then all the different parts of the fingers. All right, grind test. It's pretty much similar to the axial load, but instead now you're grasping more at the metacarpal. because you're looking more at this metacarpal carpal joint here and grinding on that area there. Okay. Oh, wait, sorry, I got that mixed around the other way. It's axial load is where you're checking down here, and then I had it right the first time. Sorry. This is for the grind test. You're checking down here at the metacarpal phalangeal or yeah. Okay. And then you have the contractile test. The Finkelsteins, you're stretching these tendons here. And you're going out this way. You can have the patient actively do it themselves, or you can stress this way. All right, now you have this Bono-Littler test. And a lot of times people it takes a little while to get this straight to understand it. So there's the de Quervain's, Finkelstein's for the de Quervain's disease. All right. So Bono-Littler, it's a mixed tissue test where you're talking about the joint capsule. And we're specifically talking about the joint capsule at this joint right here. Okay? The PIP. And you're going to be assessing the movement of the PIP. So in this case, you're doing this test on a patient where they have joint restriction at this joint right here. So now the other variable is what's happening at this joint right here. Okay? What happens is when you're in this point here, you're tightening the intrinsic muscles in the hand. Okay? If you can't do it like this, it could be that these muscles here are too tight. It could be that the joint capsule itself doesn't want to let it move. Okay? So now, at this point, I've relaxed those intrinsic muscles. And if I can move it now, you know it's because these intrinsic muscles were the problem. If I can't do it in either position, if this joint capsule is locked, it doesn't matter what position it's in, it's not going to work, right? It's not going to work down here, it's not going to work up here. So if you have a constriction in both positions, then it's going to be that joint capsule right there. Okay? If it doesn't move very well in this position, and then you move it down here, and it moves, then you know that it's the intrinsic muscle problem in the hand. Okay? Everybody follow that? So if it doesn't move in both positions, then it's a joint capsule problem.